Hello, everyone, and welcome to our interview. I'd like to give a very warm welcome today to Bec Thornton, who is the National Health Promotion Manager at Red Nose. Welcome, Bec.
Thank you. Thank you so much for having me. It's delightful to be here.
Great. So my name's Elizabeth. I'm presenting from Gadigal country today. Can I ask where you're coming to us from, Bec?
So I'm in the Yarra Ranges, which is the country of the Wurundjeri people of the Kulin Nation.
Fantastic. Okay, well, I thought we'd start off by having a look at some good news statistics. So can you tell us or help us understand how Red Nose has minimised SUDI over the years and increased safety?
Absolutely. So there has absolutely been some great news to share. What we've really seen is that over the period since the Back to Sleep campaign started, which was sort of the early 90s, we saw a really dramatic drop in SUDI deaths. So just for clarification, sometimes people use SIDS and SUDI interchangeably. I'll use SUDI because it's a broader term and it captures more of the incidents that occur. But we've seen a really dramatic drop, and essentially we went from having around 300 deaths a year in Australia from SIDS alone, which is sort of the unexplained deaths, to 10 to 20 a year. So a really dramatic decline. And we know that's because of the safe sleeping interventions that have been implemented through public health campaigns, through organisations like Red Nose. So it's a really, it's a testament to the hard work that people like early childhood educators and parents at home have been putting in to keep their bubbies safe.
That's fantastic. That's such a good way to start our interview, is hearing those fantastic statistics. So thank you for sharing. Okay, so for our participants this evening, can you let us know what you feel are the key areas of concerns that family daycare educators could improve on, or what are the most commonly reported hazards?
Absolutely. So we have some themes that do occur, and whether it's often concerns from the educators themselves about, how do I go about meeting requirements and those sorts of things. So the key things that tend to pop up are around supervision. So people really want clear guidance on how to supervise appropriately, how to meet those requirements. We also get a lot of inquiries about how to manage conversations with parents where they might be requesting something that's not in line with the safe regulations or with legal guidance or policy. So being able to have those conversations confidently and in a supportive way is really challenging, but it is definitely a learnable skill. And then I think the last one is probably around safe equipment, safe environments. So, is it okay to be using this type of product? Those sorts of questions. So we get a lot of those sorts of questions when we do education sessions, with whether it's a centre or whether it's a group of FDC educators, and also certainly through our Safe Sleep line and online inquiry form as well. So they're definitely sort of the key themes that emerge on a regular basis.
Right. Oh, well, that's good, because a lot of the things you've mentioned are things that we talk a lot about in our session, and that there's also a lot of information in our booklet. So that's great that we're trying to combat those common hazards and issues. So the next thing, can I ask you a very common question? How often in our family daycare services should we be checking sleeping babies and children?
So this is always a challenging one, and I think so to preface this with, Red Nose doesn't have specific recommendations on timing because that is a governance issue. But what we know is that best practice involves being able to identify and respond immediately if a baby or young child is at risk. So that's the principle on which everything else is based. So really the most important thing is that supervision is active and effective. And from a regulatory and guidance perspective, we know that, for example, New South Wales Department of Education requires educators, whether it's in a service or whether it's in an FDC setting, to maintain adequate supervision of sleeping and resting children. And that involves being in sight and hearing, so we can identify that child at risk and respond immediately, and also physically checking children's breathing at least once every 10 minutes. So I think there's the continuing supervision to make sure that everything's tracking okay, and then there's that sort of closer physical check as well that helps keep bubs safe.
Fantastic. Great. Well, that gives us a really good overview of what those key factors are for effective checking. So that's fantastic. And you did mention about being able to communicate confidently with families. And we know as educators that we are in a great position, not only just to care for the children, but also to support and educate families that are in our care. So what's your advice who have families that may request things going against red nose safe sleep guidelines, such as bringing them in car bassinets and asking them to stay asleep, or using pillows for under 2-year-olds? As you mentioned, we can often get requests like that. So what would your recommendations be for educators?
It's so challenging. So I just, we recognise that it can be really confronting to have those conversations, particularly where parents are quite adamant. But I think the first thing with any conversation with a parent is to acknowledge what they're saying with empathy. So often the question that they're asking, or the request that they're making, is really based in a concern for their baby. So acknowledging that we're all on the same page, we want what's best for this baby, is a really good place to start, and it helps start you off on the right foot. I think then also understanding where this request is coming from. So often when parents are doing, talking about minimising disruption, so, I don't want them taken out of a capsule because they're not sleeping well. So then we can talk to them about, what can we do to help them settle better, so that we don't need to do the unsafe practice, but we can make sure that the baby's getting enough sleep. I think the take-home message, though, is always going to be, as someone who works with children, my concern is always their safety first and foremost, and everything else has to be secondary to that. So, whether it's a service, whether it's an FDC educator, we're following these recommendations to keep babies safe. But I think this is where really knowing those recommendations and having the confidence to explain them really helps. So if, the example that you gave for baby being brought in a capsule or car seat is really common. And I think, that's a great example of where, if you understand why a baby needs to be on a firm, flat surface for the safe sleep, why it's dangerous to have them in a sitting position when they're asleep, particularly if it's not in a car where you've got, the rear view mirror and you can be sort of eyes on all the time. We know that that's unsafe. We've got really good rationales for why we don't think that that's a safe thing to do. So then we can explain that to parents. And not only, as you said, we're in such a powerful position to work alongside families, not only to improve safety in the care setting, but also when they get home. If we're modelling the things that we need them to be doing, it's much more likely that they're going to do those things at home as well.
Wonderful. Great. Yeah, really good points there. Thank you so much. So in regards to knowing each child's individual circumstances and needs in relation to sleep and rest, why is that so important, that we need to know each child as an individual?
Beautiful. So all of the guidance sort of starts out with sort of minimum standards for a typical baby, but then we need to take into account, as you said, the baby's individual circumstances and their medical history. So this is when knowing things like the risk factors that increase the risk of SUDI can be really helpful. So some of those risk factors might be, a baby who was born small for gestational age, so they were born small when they were they might have been at term, they might not have been premature, but they were born small, or they may have been early, or both. Prem babies are particularly vulnerable, but then also, babies who have an underlying health concern. So particularly things like ongoing respiratory conditions, or even just a cold, or, we try to encourage parents to keep puppies home when they're not well, but we all know that sometimes they slip through the doors anyway. If we know a baby's a bit under the weather, even if it's just that they're teething and they're throwing a bit of a temperature and they're just not quite right, knowing that, a mild illness can increase the risk a little bit. So just upping those regular checks to make sure that we're maintaining that really close supervision. So anytime you've got doubts, you're better off to increase the frequency of checking, just so that you can reassure yourself that the baby's okay, and so that you can intervene if there are any problems.
Fantastic. Great. Well, thank you so much, Bec. We've learned so much from you today. And it's really, backed up all the information that we've provided in our session. So that's so fantastic. So to finish up, can you give us some key strategies that you'd recommend for family daycare educators to take away from today's session that you feel are most important for us to remember?
Absolutely. So I think really understanding the recommendations and the underlying rationales is probably the most important thing that any educator can do to help keep babies safe. So this, allows, as I said, safe practices while the baby's in your care, but also modelling of those safe practices. So knowing, not only that we always place babies on their back to sleep, but also why that's important.
Yes.
Why it's so important to keep their head and face uncovered, why a smoke-free environment and a safe, clear cot are so critical. I think also, understanding the rationale behind things like policy. So understanding why regular checks, for example, are so protective, helps us maintain that standard and also then reinforce those messages for families when they go home as well. So I think, keeping up to date through regular training. We know that the FDC educators in New South Wales have been amazing with, engaging with education through places like Red Nose. So I think keeping yourself informed and even just revisiting that knowledge on a regular basis so that you can really clearly articulate to a family, this is what we do here, here's how it keeps your baby safe, this is why it's important, is just so, so important.
Great. Yeah. And I think that's what it's all about, just family daycare educators feeling empowered to implement all those fantastic recommendations and strategies that you give us. Well, thank you so much, Bec. It's been great interviewing you and we hope to see you soon.
Thank you so much for having me. Okay, bye for now.